Welcome to the Front Desk, the effective gateway to patient engagement. This training is a result of a dynamic partnership between the South Carolina Office of Rural Health and South Carolina DHEC's Department of Cancer Prevention and Control. By the end of today's mini course, you'll learn about the impact of the patient care experience on screening, treatment, and your practice's financial profitability, as well as learning 2 practical strategies for providing excellent customer service and increasing engagement for your BCN patients. What you'll need for today's lesson. You'll need about 30 minutes to 45 minutes of uninterrupted time, a quiet office space or room, a laptop or desktop computer, and a notebook to jot down hints that will be given during knowledge check slides throughout this lesson. Funding for this training was made possible in part by the Centers for Disease Control and Prevention. The views expressed in written training materials or publications and by speakers, moderators do not necessarily reflect the policies of the Department of Health and Human Services, commercial practices, or endorsed by the federal government. The building blocks of an effective BCN program are the following. Each program should have a practice champion, defined team roles, billing and coding knowledge for reimbursement, and an activated EHR screening reminder system. And what we'll be talking about today is an excellent patient care strategy. Focusing on the patient care experience is important for a few reasons. The experience determines their level of trust with the provider, determines compliance with annual screening and treatment recommendation, and impacts the financial health of your facility. In a series of focus groups ran from 2016 to 2019, BCN patients reported experiencing mistreatment during clinical services, unable to get return appointments due to bills, being treated like a charity case, and challenges around transportation and unemployment. Hint, hint, break out those notebooks for our first knowledge check. Number 1, name 2 building blocks of a great BCN program. Give 2 reasons why the patient care experience is important and describe 2 barriers to care. If you need to pause and rewind the video, you can. So far, we've talked about why it's important to provide great patient care and the barriers to care for low-income women. When a patient has a poor care experience, it damages their trust in you as the provider. It causes undue economic burden on the hospital and healthcare system, bad community representation, and avoidable late diagnosis for cancer, chronic disease, and even premature death. Here are some practical strategies for improving the patient care experience. Survey your patients at least twice a year. Managers should shadow front desk workers. And 3, revise sliding fee scale policies to enable patients to come back for critical screenings and follow-up care. Here are some keep it simple patient care principles. Number 1, share your name and always ask how you can help the patient. Smile and maintain eye contact to put them at ease. Ask them how they are doing and explain the check-in and care process in plain language. Also, be prepared to help patients with limited reading ability fill out their paperwork. 6, if English is a patient's second language, always provide translation and materials in the patient's native tongue. And number 7, treat them as though they were your family member or neighbor. When a provider gets the patient care experience right, it results in increased revenue from initial and follow-up visits for BCN patients. A BCN patient can transition from the program to making your facility their medical home, and the services offers meet other clinical quality improvement measures. Hint, hint, break out those notebooks for knowledge check number 2. Number 1, name 2 consequences of a poor patient care experience. Number 2, name 2 benefits to you as the provider. And 3, name 2 KISS patient care experience principles. Pause the video if you need to. What have we learned today? The importance of providing a great patient care experience, the consequences when patients are treated poorly, And number 3, very practical strategies that you can implement in your medical home as soon as you're done with the course from the front desk and beyond. Congratulations, you've just completed your course. Number 1, review your notes and PowerPoint slides. Click the next button below and take the quiz, and then download your certificate. Thanks so much for your participation.